So, hello, I'm Banu Upadhyayula.
I'm Isha.
I'm Vedika Kanaki.
So, today we have another guest with us discussing more about carpal tunnel syndrome. Dr. Neilson, could you introduce yourself, your profession, along with what carpal tunnel syndrome is?
Yes, my name is Denise Neilson. I am a certified hand therapist. I've been working for 20 years at Valley Care, which is now part of Stanford System. And I work in a hand clinic in the outpatient setting, and I work with a lot of patients that have carpal tunnel syndrome. So carpal tunnel syndrome is specific to a wrist injury that can be considered like a tendonitis, but the nerve gets involved as well. And it's in a specific region in the wrist. As all the flexor tendons and all the other structures travel through the inside of like your wrist, where you would rest it on a table if you were like mousing, that area right there where you're like leaning against the table would be the area. And these 10 different structures kind of shoved together through this little tiny tunnel. And the median nerve is one of those structures. That nerve, when it gets compressed, causes carpal tunnel.
So what are some of the most common causes of carpal tunnel syndrome that you have seen?
Most common causes are like repetitive use or pressure into that area. It's commonly known when someone has bad ergonomics and they're kind of like leaning that wrist on a hard surface for an extended period of time, that it would cause pressure on the nerve and cause symptoms. You can also get it, a lot of people tend to sleep with their wrists kind of bent at night. It's kind of a common position to sleep with. And over time, that can cause carpal tunnel as well. Other not quite as common causes, but it does happen, is you can get a traumatic carpal tunnel syndrome, which would be when you have taken a fall, maybe get some kind of a break in the forearm, but if the impact happens right at that area, you can get a traumatic carpal tunnel. And then it's also really common during pregnancy for women when they have all the excessive fluid in their body. They really commonly, towards the last few months, get carpal tunnel in both wrists.
So, which age group would you say is most at risk for this condition?
You know, I'm not sure if there's a particular age group most at risk. I think it has more to do with the type of activities people are doing. So the more you're on like a computer, especially like laptops, you'd be at a higher risk category for it. Or people that do really repetitive work that would involve wrist motion or pressure into the wrist, they would be at higher risk for it. And people using tools a lot, like mechanics, plumbers, because they're having to like crawl in small spaces, use tools with really awkward wrist positions, they would also be at higher risk. But I don't know if it's necessarily like an age group, it would be more like occupation based.
How common do you think this condition is from what you've seen or what you've heard?
It's actually a pretty common condition, but it can be related with other diagnoses as well. So someone might come into my clinic with a diagnosis of like tendonitis, and really they do have some median nerve compression. So it could be like combined with other diagnoses. Like I was saying, the fracture, they could have a fracture, but they could have the underlying cause of carpal tunnel as well. So it's actually a pretty common type of repetitive strain injury that a lot of people have.
So do you think the pandemic and stay-at-home orders could increase or have an impact on the cases of carpal tunnel syndrome?
Yeah, I definitely think we're looking at a lot of people with a lot of pain and tendonitis and carpal tunnel syndromes from having the stay-at-home work order, because everyone, well, a lot of people suddenly were taken out of their workspaces where maybe they had had an ergonomic assessment, they had equipment they were using, you know, like a nice setup, and they were moved to their home environment where, you know, there's even like kids, siblings, you know, you're all working like maybe sitting on a bed, sitting on a couch, or multiple people trying to use one table. No like high-low options. There's no desk adjustments. They're not sitting in office chairs. They're sitting in kitchen chairs. And I think a lot of these kind of issues definitely are playing a role in that.
So, do you work with any other health professionals when managing CTS for a patient?
Yeah, so being a hand therapist, we work under orders of usually orthopedists who are, or sometimes neurologists, sometimes family care practitioners. And they initially see the patient, diagnose them, and then send them to me for treatment. And then depending on if I is going to be helpful as far as therapy goes, I'll either keep them or sometimes refer them out if I feel like they need further testing, like maybe the nerve is too impacted and therapy is not going to be helpful. Sometimes we'll send them out to like a neurologist for nerve study testing. So I work with the doctors. I work in my own clinic, I also work with physical therapists. If I feel like the carpal tunnel maybe also has a neck component to it, I'll refer them to the physical therapist to address posture and the neck, and then I'll treat the hand portion of the injury.
So is occupational therapy an option for anyone that is diagnosed with CTS, or are there any restrictions?
We could actually treat anyone that's diagnosed with carpal tunnel syndrome because even if it's a mild case, we can make suggestions for splinting, for different adaptations at home so they're not aggravating it. In the case where it's like the pregnant moms that have carpal tunnel syndrome, we can make suggestions for how to keep the swelling down in that area, or braces to wear until they have the baby, because their symptoms usually change after they've had the baby. But we can make even just like a couple visits can be enough to kind of teach people how to make changes so that it doesn't become a long-term injury.
So how would your treatment recommendation differ for a patient who has mild carpal tunnel versus someone who has severe carpal tunnel?
If it's a mild carpal tunnel, they may not need as much treatment. They might just need, like I was saying, just some adaptations for home. They might need some splinting, just more education based. And someone that has severe carpal tunnel, sometimes surgical intervention is the best option for them. So I would refer them back to the orthopedist for surgery, and then they would return to me afterwards. If their age or there's a reason why they can't have surgery or don't want to have surgery, then my treatment option changes. We do a lot of different things, really trying to help that nerve so that it's not so compressed, and so that they don't start losing feeling in the muscles into the hand.
So what's the recovery process for carpal tunnel, and how long can it take?
After carpal tunnel surgery, there's no precautions, so they can go back to using their hand as soon as it feels good. Some people, that means like a week. And then other people that I've seen, maybe they've built up a lot of scar tissue, maybe they're get an infection, so there might be some secondary concern that causes a prolonged healing process. There's also a condition called a CRPS, which is kind of like the nerves kind of freak out a little bit and create an overlying like hypersensitivity. And if someone develops that, it's a much longer process to get better, but it's a rare condition, but it does sometimes happen. So on average, I would say most people feel pretty good within a month. And are back to their normal routines and are able to type no problem. Some people less, some people a little bit more time, depending on how severe that nerve was and how quickly their own body heals.
So if someone doesn't seek help for their condition, what is the worst case scenario?
If you don't seek help for carpal tunnel and the nerve continues to be compressed over time, you'll lose the musculature in your hand that allows you to do a lot of different fine motor movements. And you can actually start losing function and not have that nerve innervation to those muscles anymore. So you'll see kind of this wasting in the hand, like you start losing like this meaty part of the hand right here. You start losing all those muscles, and you can actually lose a lot of function of your hand if you don't have that nerve. So if that starts happening and I start seeing that in a patient, I'll refer them right back because they definitely need surgery so that we can try to get those muscles back.
So what are some activities that you do during a session for someone who's being treated with CTS?
So we create individualized treatment plans for every patient. And basically what I do upon evaluation, the patient comes in, we talk, I do measurements. I look at range of motion, their strength, their functional ability, and what they personally need to do throughout the day, what's important to them. So I talk about their leisure activities, what their work habits are. Do they have a family? Do they cook throughout the day? Like, what are their tasks that they need? And I tailor my plan to those activities. We're very focused on, patient-focused treatment plans. So it's very individualized. And the activities would include whatever problems I've pulled out from during that evaluation process, which would could be maybe they're having a lot of pain, maybe their hand is super swollen, maybe they've lost a lot of strength in the hand. Maybe they're trying to feed a newborn baby and they can't hold the baby because it hurts so much. And I take those and I turn that into my treatment plan, which would be things like modalities, which includes like heat or ice, maybe ultrasound, sometimes TENS unit like electric stimulation, laser, we have that available, and some things like that for different modalities we can use. Then I would also teach them stretches, different active range of motion exercises, nerve gliding to help get that nerve so it's not so stuck in the tunnel. I would do functional activities or education on how to adapt the activities they're currently doing at home. And then finally, once we've gotten the pain down and the swelling down, we can start focusing more on the strengthening aspect. And then we get to do things with TheraBand or Theraputty to do strengthening. And it's all based on what they need to be able to do and like throughout the day. So if they're, let's say, a guitar player, sometimes I'll have them even bring their guitar in and we can make some adaptive devices to help them become independent with it. If it's something they can't maybe hold the guitar, I've kind of created a brace before that allow them to hold it without pain. I have one patient that I'm creating a splint with the pick out the side so that they're able to strum without having to physically hold the pick itself. So we do a lot of adaptive devices to allow them to be as independent as possible with their activities.
And what are some prevention methods, or how do you think people can prevent carpal tunnel syndrome?
The best prevention is good positioning and not doing anything repetitive. I try to tell everyone when I'm educating them that you want to, with your arms at your side, anything you can reach in that zone. And I say like a T-Rex, you know, you have little arms, anything in that T-Rex zone is in the safe zone. When you start reaching beyond that, that's when it puts you at risk for tendonitis or carpal tunnel type syndromes. And think about that every time you reach for something, that's kind of far. I do that 30 times a day. You know, that's putting you at risk every time you do those things. So I think proper education, proper setup, and just in general, maintaining some kind of a stretching routine or like yoga, things like that, where you're maintaining, you know, so things don't get tight and you're maintaining that stretch is really the most helpful things to avoid it.
Okay, so that last question concludes our interview. And thank you so much for your time. We greatly appreciate you coming out today to share your information with us and our viewers.
Thank you so much, Denise.